Morning, my name is Dr. Balaji Sai Baba. I am a consultant in orthopedic surgery. Today I am going to brief you about osteoarthritis, which is a very common problem. By definition, osteoarthritis is a type of joint disease in which there is loss of protective joint cartilage and underlying bone. It is also called by other names such as wear and tear arthritis, degenerative joint disease, or degenerative arthropathy. So the most common sites include knee, hip, neck, lower back, hands and feet. Almost any joint in the body can be affected by osteoarthritis. So the most common symptoms of osteoarthritis are pain, swelling, deformity or bowing of legs. Patient can have gait disturbance. Patient can have even crepitus, which is a cracking sensation heard in the joint, or they can have a locking sensation. In long-standing cases, patient can even suffer from depression, poor cardiac reserve, poor glycemic control and poor control of their blood pressure. The patient's day-to-day activities can be significantly limited. The causes for osteoarthritis are mostly age-related. Any person beyond the age of 50 can suffer from osteoarthritis. In general, women who are postmenopausal are prone for osteoarthritis due to their hormonal imbalance. Occupation, patients with physically demanding work such as those who require prolonged standing, bending, lifting of heavy works, and twisting of their bodies, kneeling down, squatting are all prone for osteoarthritis. Patients who are obese, overweight are prone for early osteoarthritis. Patients with poor glycemic control are also prone for osteoarthritis. Patients with physical inactivity, patients with poor muscular power, patients with nerve impairment are also risk factors for osteoarthritis. So coming down to the diagnosis of osteoarthritis, it's mainly diagnosed by history and clinical examination. It is confirmed by an X-ray which shows the characteristic telltale signs of osteoarthritis such as joint space narrowing, subchondral sclerosis, subchondral cyst formation and bony spurs or osteophyte formation. So coming down to the treatment, so the main line of treatment of osteoarthritis is lifestyle modification, which includes regular exercise, adequate weight control, good control of comorbidities like diabetes, and wearing knee supports or knee braces such as knee cap or using crutches for walking. Patients can undergo a course of physiotherapy, which includes a local form of heat therapy such as interferential therapy or shortwave diathermy. They have to undergo regular training for their knees such as strengthening exercises, range of movement exercises, aerobic conditioning exercises and balance training exercises. The weekly recommendation for aerobic exercises include 150 minutes of moderate intensity activity, which translates to 30 minutes of swift walk 5 times a week, or 75 minutes of vigorous intensity activity 3 times a week. The other medications which are used for osteoarthritis include paracetamol, NSAIDs such as etoricoxib, ibuprofen, naproxen. Patients can even go for a trial of low dose mildly potent opioids, and patients can even follow supplements if required. The supplements include chondroitin sulfate, glucosamine sulfate, methane sulfonate methane and undenatured collagen. So of late, injections have become the mainstay of treatment for osteoarthritis in resistant cases. Injections include steroid injections, PRP injections and viscosupplementation called hyaluronic acid. In advanced stages who are not recovering with medicines and physiotherapy, they can go for surgery. Surgeries include either corrective osteotomies or total knee arthroplasty. Thank you.